I enjoyed a 20-year career as a chef and restaurateur in the San Francisco Bay Area. There was something still nagging, and I felt that I could really make more of a difference and be more effective in changing lives. As a nurse, you get to follow someone through their life cycle. You get to follow someone through their hospitalization and see the transformation that happens to them. Now, why did I want to come to Columbia specifically? Because of the reputation I know of the hands-on and the clinical experiences. Nowhere else would we have clinical sites as wonderful as we do here at Columbia.
I've been a nurse for over 50 years. I graduated from Columbia in 1964 with one of the largest graduating classes. And since then, I've gotten my master's and my doctorate. I've taught at Columbia, I've taught at NYU, and I've also been teaching internationally in Mexico and also in South Africa. And a lot of this confidence came from being a Columbia nurse. We were told from the very beginning that we were leaders. And as leaders, we knew that we had to be willing to take risks. We had to be in the forefront.
I'm an immigrant. I was born in Guyana, South America. I joined the military, United States Army, and became an infantryman. I feel that services like nurses, teachers, doctors, soldiers, they kind of give to the country, they give to their communities, and I wanted to.
Working as an emergency department nurse was very stressful but incredibly gratifying. My research is around quality of care in the emergency department, and specifically I'm looking at emergency department crowding and infection prevention practices. Now that I have my PhD, I'm very excited to report that I have a joint research position both here at Columbia Nursing and also at New York Presbyterian Hospital. I am proud to be a Columbia nurse.
When I first came to Columbia for an interview, I knew that's where I wanted to go. It was actually the most important decision I've made in my life. I think the reputation was, as it is now, it's always been a center for excellence. It's always been the best of the best. I ultimately went into public health and neurology and absolutely loved it. Columbia taught me that what I was taught I could do. I am a Columbia nurse.
Columbia Nursing gives me the support that I need to continue with my goals in terms of becoming a midwife. Right now, at this point in my life, I would like to practice in the inner city, working with minority women, working with low-income populations and families. That would be my dream to do. I am a Columbia nurse.
I am a pediatric nurse practitioner. I work in a pediatric primary care practice out in Brooklyn. We do everything ranging from newborn well visits to pre-college physicals, sick visits. People can really take my caring for their kids as not just she's doing this because she's a healthcare provider, but because I really care about their children and what's going to happen to them in the future. I am a Columbia nurse.
I became the assistant director of a department for about 4 years, and then a director, and then a vice president of the hospital. Then, with another colleague, I built the global program, or the international program, for the hospital from the ground up. Literally building the space, hiring the staff, writing the policies, and beginning an international program for New York Presbyterian. I became a senior vice president, working for Dr. Herbert Pardis, was the president and CEO at the time. And my title changed to Senior Vice President for Patient Services and Special Assistant to the President and CEO. I am very proud to be a Columbia nurse.
I'm in an adult gerontology nurse practitioner program, and I've started taking classes now to do the seamless DNP, where you just transition into the doctorate. Everyone here really seems to care that much. Some care more about academics, some care more about research, some care more about clinical practice, but I think having all of those different people with the ultimate goal of patient care at the end is the best thing about Columbia. I'm proud to be a Columbia nurse.
I've always liked helping people. You know, whether I'm working in, shanty towns in Cape Town, South Africa, or I've been doing a lot of work in Haiti. It's the public health experience that I had at Columbia. If I had it to do all over again, I'd still be a Columbia nurse.
I feel very excited as a nurse informaticist, because I feel like I'm in the center of the future of nursing. I'm in the center of what's happening in society, intersection of all kinds of interesting trends with how people manage their health, how people access technology. I am a Columbia nurse.
I think that the choice to come to Columbia is one that you shouldn't take lightly. I think that it will transform the way you think. You will be exposed to everyone and everything and every patient population, and I'm so grateful for that. What you'll carry with you is a sense that you have the skills you need, you have enough resources around you to help carry you through any new experience. I am a Columbia nurse.